One thing that's really special about Geisinger is our expertise in health systems science. We're one of the nation's leading systems in value-based care. That's really cutting-edge care that prioritizes patient and population outcomes. It's different than the typical fee-for-service model, and it's the way of the future.
Graduate medical education at Geisinger is quite large. We're up to 56 accredited ACGME, so physician-focused programs. In all totality, we have about 86 unique, independently accredited graduate medical education programs. The other unique thing about our health system for trainees is that we are also a subspecialty and super specialty organization. And so for that reason, the breadth of pathophysiology that we see within our healthcare settings is very robust, and our residents and fellows receive training from all the common illnesses all the way through to the most unique and rare diseases.
I trained in a very large community hospital down in Baltimore. But when I moved here to Danville, everybody said to me, oh my gosh, you're moving from Baltimore, what's it like? Are you gonna be able to adjust to living in such a smaller town? While maybe the town itself is smaller, the moment I stepped foot in the doors at Geisinger, I was amazed and in awe of how big the hospital is and how big everything is here and how many resources we have here. So despite coming from a bigger city, really I felt like everything here in Danville was bigger.
We have one of the largest genomics programs in the country that's been developed in a healthcare system. So we have almost 200,000 of our patients who are sequenced. That's about 20% of our patient population, where there's DNA information that can be used to help us learn more about diseases and how they occur, can help for future drug development, actually can be used for identifying patients who are at risk for particular genetic conditions.
We are always advocating for our patients, even when we do rounds, every single member of the team gets to express his own thoughts and beliefs. But the end goal is to provide the best quality of care at Geisinger.
Geisinger has an increasingly robust culture around diversity, equity, and inclusion. The affinity groups that we currently have are the LGBTQ plus affinity group, we have the Black affinity group, we have the Muslim affinity group, we have the Latino affinity group, and we have the Women with Families in Medicine affinity group. And those are inclusion communities for residents and fellows that identify with those shared identities and are looking to build both a professional network, but mostly a personal outside of work network.
My role is to work with the department and the institution overall to make sure that residents are being thought of, that their well-being is prioritized and valued, and that the connection is made between their ability to provide quality patient care is predicated on how they're doing personally. I'm available to meet with residents if they have personal or professional concerns, and to work with program directors and leaders to think about how do we create an environment where they can thrive, not just survive residency.
All of the residents to the ancillary staff to the attendings, everyone just creates such a supportive and kind environment. And I think even on the hardest days in medicines, which can get very hard and very dark, you walk down the hallway and you see a friendly face and it just can help turn your day around a little bit. I think that's unique to Geisinger. So it makes me confident that Geisinger is a fantastic place to train, and I would choose it again and again.
I always think about residency as sort of like an opportunity to develop on different aspects. I feel like my program is helping me to become a good clinical decision maker. Also, they do focus on aspects outside work, individual development. I am part of the community outreach leadership track, which is basically helps us to understand the community that we are working with.
We want our residents to become part of the communities that we serve. There's so many outdoor activities that our residents engage in: mountain biking, hiking, fishing, exploring the wilderness.
We actually have a really great group of residents in my program that love to run. And so we have a group message and people will throw in local kind of races and things of that sort.
I have been at Geisinger a long number of years. It has been where I've chosen to have my professional career. It's also been the area that I have chosen to raise my family and have my children. And it's been a wonderful area to grow personally as well as professionally. I just can't say enough about the community. I came because of the opportunity. I have stayed because of the people.